Hello everybody, my name is Avni Bhadang. I'm a recent medical graduate from India. Today I'd like to discuss acne with you. Acne is a very commonly discussed problem today, specifically amongst our teenagers. Acne has a significant impact on our lives, wherein it's never just the acne, but also the added stress of having acne and the psychological impact of having acne in our lives. Hopefully through this video, we will be able to discuss acne better, understand the disease process better, and just deal with acne better. In this particular video, I'd like to address what exactly acne is. Why does it occur? What are the signs and symptoms of acne? What are the treatment modalities used to treat acne? And what are the various myths and misconceptions that people have about acne? And hopefully be able to discuss them in detail. So acne, to be very honest, acne is a very broad category of disorders. There are many multiple types of pathological types of acne. Acne can not just occur on the face but also on the chest and the trunk. And the acne that we most commonly see today is the acne vulgaris. In this video, we will be talking in detail about acne vulgaris. So take a look at the diagram and the picture alongside in this slide, and you will see that this particular image is a diagram of a split section of the skin showing the hair follicle. And like you can see here, the hair follicle is surrounded by sebaceous glands, which allow for the hair strand to be properly moisturized, the hair strand to be properly smoothened. And here you can see that acne vulgaris is actually a chronic inflammatory skin disorder, and it's most commonly caused because of hair follicles being blocked by oil and dead skin cells. What normally happens as a normal process in everyone's body is that our body periodically has a process where it sheds old skin and replaces it with the new cells. And this particular process is commonly called as desquamation. So if this particular process is happening abnormally, maybe more, then what happens is there's abnormal shedding of keratinocytes, and they end up blocking the hair follicle and getting accumulated like you see here. Another risk factor of commonly seen in acne is during puberty. So what we normally see is which is a normal misconception, is that acne only occurs during puberty. That's not necessarily true. What actually happens during puberty is that there is a physiological spurge in the level of hormones, also known as androgens, and that causes hyperplasia of the sebaceous glands like you can see here. And because of that, there is an alteration of the follicular growth and differentiation, and that causes a change in the physiologic mechanism of shedding, further contributing to the blockage in the follicle. Apart from that, you also have so basically, because of this accumulation in the follicle, it creates a perfect environment, gives it a perfect pH for a certain bacteria to grow and accumulate. This bacteria is also called Propionibacterium acnes, and it accumulates in this particular area, causing further inflammation. All of these factors are further compounded by genetics, and all of that finally makes the pathogenesis of acne. What is interesting to note is that in women we have a particular gynecological disorder which we call PCOS, polycystic ovarian syndrome. In this particular disorder, you see a pathological increase in the level of androgens, and that's why PCOS is often associated with acne on the face. But that's a significant tie-in that you can really help relate your understanding of acne with. So what are the signs and symptoms of acne? Now, for most of us, we're very familiar with the signs and symptoms of acne. We see them on a day-to-day basis. We often find ourselves lurking over a mirror just to monitor the growth of our pimples and our pustules. But nevertheless, this is a broad category, a broad imaging of the different types of lesions that are seen in acne. And what would be good to know is the pathomechanisms behind each of these lesions in order to get a better understanding of acne on the whole. So let's get to it. So acne is a basically broad spectrum of lesions, like I showed you in the previous slide, and it starts to increase in severity as we go down this train. And It could be anywhere between just whiteheads and blackheads to really pus-filled lumps called pustules, often compounding and forming scars and other skin changes. So whiteheads are basically comedones that are caused because of follicular hyperkeratosis and blockage at the skin level. And whiteheads are often plugged by a layer of skin on top. But if this plug is not plugged by the skin on top, then the blocked material in the follicle can be exposed and gets oxidized, and that's why it gets that black color, often called as blackheads. With further inflammation, we see the development of red tender bumps, which are also called as papules, further accumulating more pus and further causing inflammation, forming pustules, which are papules with the pus at their tips. And then you have large, solid, painful lumps under the skin that are also called as nodules. The final stage of each of this chronic inflammation often amounts to scarring, which is visibly disturbing for most of us, and that's what I'm going to discuss further with other skin changes. So scarring is basically, the idea behind scarring is the development of collagen. There are two types of scars. It could be a hypertrophic scar, it could be an atrophic scar, depending on the amount of collagen in that scar. In our body, with respect to collagen, we have two enzymes called metalloproteinases and metalloproteinase inhibitors. And depending on the level of these enzymes, we could have either metalloproteinases, also called as matrix metalloproteinases, which break down this collagen and cause atrophic scars, or matrix metalloproteinase inhibitors, which prevent this breakdown, and accordingly you have those kind of scars. So the scars basically begin from that clogged pore, and then they become inflamed, and then you have abnormal collagen that finally results in the scarring. So as far as acne is concerned, there are a lot of over-the-counter treatments that are available in the market, and a lot of us do use these treatments on and off to get rid of our blemishes. But if these lesions go to a level where you cannot control them with OTC medication, then it would be a good idea to speak to a certified dermatologist if you cannot control the lesions at hand. A dermatologist essentially will help you control your acne, avoid scarring and other damage, and make these scars less noticeable, more cosmetic. So let's get to the treatment. So the treatment is in ascending order of severity. You can have topical treatments and you can have systemic treatments. Topical treatments are basically for comedonal acne and also act as a maintenance therapy for very severe forms of acne to maintain them in comedonal acne. So in these you have retinoids, antibiotics and benzoyl peroxide. Retinoids are topical therapy that are used to decrease the hyperkeratinization of the skin, and they help with the first step in the formation of acne by reducing that follicular hyperkeratinization. Another treatment modality that we do use is benzoyl peroxide. It's very commonly used. The reason being that it's bactericidal with activity against Cutibacterium acnes on the skin and within the hair follicles. And it's also keratolytic, and it's used in combination with certain antibiotics. There are other topical antibiotics used which contain components like clindamycin. These antibiotics are anti-inflammatory, but they also have the added risk of creating bacterial resistance and often are used in combination with benzoyl peroxide if required. If there is an increasing severity of acne, systemic antibiotics are the mainstay for a moderate to severe inflammatory acne. And these include medications like oral antibiotics, hormonal therapies, and isotretinoin. Oral antibiotics and hormones are again being researched. Oral antibiotics are well known. Hormones are being researched in acne vulgaris. Hormones like estrogen and spironolactone can also be used, but again, should be your dermatologist should be consulted in this. So coming to certain myths that I'd like to discuss with respect to acne, it is very important to clear and demystify these things because word gets around a lot really fast, and I think it's my duty, maybe as a provider, to be able to help you with understanding these myths. So let's get to them. The first one is eating greasy food causes acne. Now, the real idea is that just by eating greasy food, you may not get acne. What's important is, of course, to keep hygienic, and as long as you're keeping hygienic, keeping your face clean, keeping your hands clean, and not touching your hands on your face too much, that is not necessary. Eating greasy food is not necessarily going to cause acne per se. Nevertheless, I mean, notwithstanding the fact that eating healthy food is an overall help to your general health to keep it status quo, but as such, eating greasy foods will not cause acne. The next one that we commonly hear of is using cosmetics will cause acne, and that's not necessarily true. Cosmetics often today, at least now in the market, we get many kinds of cosmetics which are skin friendly. Of course, if you use very oil-based cosmetics, then yes, that could be a problem. But again, consult your dermatologist accordingly, and cosmetics as such should not be a problem. Next is drinking extra water will cause the acne to remit. Now, drinking water in general is a great idea to keep your health in place, but otherwise, extra water is not going to cause the acne to remit and make your skin clear. So that's another myth that should be taken care of. The last one I'd like to discuss is applying toothpaste on your pimples will help the acne go away. And this is something that I've been told by so many people growing up, that if you get a pimple, you just apply some toothpaste. Now, the science behind it is actually back in the day, toothpaste used to come with a certain ingredient which was known to be bactericidal. But over the years, they've replaced that secret ingredient with something called as methanol, and applying these ingredients now to your skin can often cause irritation and allergy, and that's why applying toothpaste on your pimples is not a good idea. But yeah, so this summarizes some of the myths. There are many more of these available on the internet, and yeah, I will link put the link in the description too. But yeah. So yeah, that brings us to the end of this video. To conclude this video, I'd like to throw some light on the other aspects related to acne. There was this very interesting study that I read. It was published a couple of years ago, and while I was researching for this article, I came across it. It was published in JAMA Dermatology, and they conducted a study across about 6 countries in an exercise called as Letters to My Disease. And the participants were they were divided into groups with facial acne and facial scarring, acne scars, and two or three groups. And the results of these studies showed an evidence-based reportage on patients being self-conscious because of their acne, often reporting very low self-esteem. A lot of them also complained of having to cover their acne with makeup or clothing. And in general, I find that most of the spin-off of having acne was they were having to have other mechanisms and other methods of coping and maintaining a good social life. Again, peer pressure is also an added pressure in most people's lives. So what I'm trying to get at is that it's not just having the acne, but there are also added, there are other reasons that acne needs to be taken care of. And if your acne is controllable, that's great. But if you do have issues with controlling the acne, if it's getting out of hand, it would be a great idea to meet a certified dermatologist who can help you with appropriately managing this acne and its progression, and of course, taking care of your overall health. So with this, I conclude my video. I hope it was informative, and yeah, have a great day. Thank you.